In case you haven't heard, America's medical industry is pretty effed, but it doesn't have to be. Welcome to Right to the Root. I'm your host, Stephanie Wright, and I've built my career on helping practices reach their full potential. Join us as we dig down to the root of the insurance industry's most complex problems and how we might be able to turn it all around. We're back for episode 3 with Dr. Kurt Lindberg. If you didn't listen to episode 1 and 2, you really have to, because episode 3 here, we really start talking about the different nuances we have and also concierge medicine. We talk about what does comprehensive healthcare look like and where does all of this medical waste money go? So I want to ask, and again, too, and I know that you say that, and I totally get it because I only know this much about health insurance myself either. I'm just really catapulting myself to learn everything. Why do you feel as though my voice speaking out against Delta Dental, that they served me a cease and desist?
I don't have any explanation for that, no. I'll just go back to the basic statement of they're a company that is trying to stay. I don't know if they are extremely profitable or barely profitable, but I do know that their goals are to reduce how much they pay out.
They're very, very profitable. And again, too, so the profitability that is within the insurance companies, but then we also kind of look at it and say, is there the need to have millions of dollars on somebody that works in an executive position that couldn't be funneled in different ways? Right. And so to me, that is a greed system. That is a for-profit system that they want to choose profits over patients because they had somebody out there that was really, really successful at getting patients to understand their dental care, their dental benefits, and that it's not your doctor's greed. Right. And having them turn back to and trying to have them hold the insurance company accountable, messaging them and letting them know, how come you haven't done this? How come your all other dental benefit plans will pay the doctor directly, but you won't?
So in healthcare, the insurance companies are beholden to star ratings. Have you heard of this?
Yes, I have. Yes.
So some of the stars are patient satisfaction. So patients get a questionnaire of how did things go? How was your experience? And they will get graded good or bad based on that answer.
Yeah. So
I don't know if the same accountability exists on the dental side. It sounds like maybe it doesn't, where if you have patient complaints, your star rating goes down and you have less income. Yeah. So it sounds like there needs to be more accountability on that side of the ledger.
There absolutely has to. And it's, I'm talking to a periodontist and, she's like, I can no longer stay in network with them because, I'm under a focused review is what it's called, or an audit per se is. And she was for billing out this code D0180. The description for D0180 is comprehensive periodontal evaluation for newer existing patients. And she's a periodontist. Yeah. And that's what she was in a review and had to provide all of this. And it's like, that is every single patient that's being referred to her.
We on the medical side, we have different payments based on how complex the visit is. Mm-hmm. And there was a time going on there, and I think this has fallen by the wayside, where the insurance company figured, well, we'll look at the doctors that are charging the higher complexity visits too often, and we'll get on their case and we'll make them stop it. Yeah. It's like, what if I have really complex patients and I'm talking about their mental health in addition to their physical health? Yes. And I'm realizing that depression affects the way you take care of yourself and your diabetes, which prevents heart attacks. That's a longer visit than I can do in 10 minutes. Yeah. And you should be encouraging me to have complex visits. So absolutely, because you're preventing a lot of other problems. Yeah. So
that goes back to my own psychiatrist as well too, and having that conversation of. They're saying you're billing out too many codes that are for 30-minute appointments. You need to make it into 20.
Yeah. Right.
Talk about everything.
Well, that's the short-sighted way to save money in healthcare. Yeah. Right. Yeah. Is either you reduce the amount you pay out for each thing, or you make people, jam more people in a day. And I think we've run to the end of that story. Yeah. We were now chugging out too many visits and
quality.
Yeah. And I think we need to go back to the drawing board and say, what is the more effective way of helping keep people healthy so they don't get sick and they don't spend money? Yeah. That's a better way to save money.
It absolutely is. And again, too, it's this vicious cycle and corporate greed that, ends up into the mix of it. The privatized health system is, I don't quite know how dismantling that would be. And, because even though there is laws and rules as far as like how much profit that they make, but again, too, you tie it back into saying like, why do you have employees that make as much as that they do? And now truly United Healthcare got one of their own employees murdered because of this system. And
At least the
denied care.
optics of it, right?
Yes, the optics of it, of denied care. And it just goes so deep into it. Me getting that cease and desist on it, it just really confirmed as far as the accountability that needs to be had on the insurance company's end and the change of the system.
So yeah, they sometimes, I don't know if you've heard the term in the healthcare industry, we talk about the triple aim. Have you ever heard that term?
I have, yeah.
So trying to keep costs down, trying to make sure quality care is provided. Those are the two. And the last one is patient experience, making sure patients have a good experience. And it's good that we hold ourselves to that and that insurance companies are being rated based on that. But it's certainly a big part of it is that you need to make sure you help patients have a better experience when they call your number or they ask for care. And if your answer has to be no, it has to be done in a way that's expressed in a kind and say, I'm sorry, but we've had studies that show that. Let's try and help you get the care that we think would help you more, or have you see a different specialist who can maybe look at it from a different angle. But it has to be done in a way that's compassionate, right? Even if it is trying to be efficient in quality.
So is it every insurance company that, because now I know when I receive those surveys that don't even think, I'm going to fill them out every
they're
single
very important. We're desperate about them.
Please fill it out. Yeah. It's almost like when you're leaving.
It takes a long time. I get them too. When my family gets healthcare and I get them, I'm like, I never realized these things are so long.
They're so long. It is. And so you think about it, right? And it feels like the same as when you're going through the drive-thru and you're like, we strive for $5.
Yeah,
right. I'll get my free burger. Yes.
Right. It's good to be honest because it does drive, even here I'm in my own private practice, how our front desk staff are trained, right? What 100%. Do we say when you call on the phone? I mean, because we know that's going to affect their ratings and so there needs to be an accountability beyond just finances. We've been talking a lot about finances and quality of patient experience and that absolutely agree. Needs to continue.
Yeah, because there are also doctors out there that equally don't like the insurance company, but they're also not doing what's right either, right? And they're pushing these things through and bringing out that survey aspect and that patient satisfaction is. I'm absolutely going to be learning more about this and how this could be even carried over into dentistry, because you're absolutely right. That patient satisfaction is so spot on of what it is that we can do in the experience. Are we going to make everybody happy? Absolutely not. But that training, that opportunity, again, to how much it is
help
that
them
they
understand their benefits, help them access their benefits.
I'm genuinely interested in identifying a way. Maybe Delta Dental will actually talk to me now if I bring up something. I'm like, I have an idea where maybe you won't hate me so much.
Right. And I think that's one of the ways we make change too is assume good intentions in others, right? Because I think even the people I disagree with the most strongly, I understand their intentions are good. And they just maybe see things differently than I do.
They need to, look at it from a different standpoint than what the media is displaying for this. And I'm going to certainly stop using the word universal because I don't want to limit my audience on identifying, who, if somebody's listening right away and hears universal health, be like, oh yeah, there's another lefty over there, you know, and I don't want that because it's genuine I open right up that there's not a perfect system anywhere. Dental, who I know far more about, I'm learning gets shafted the most in other countries as well too, right? And, diving deep into it and that technology and what it is that we can provide onto there and that patient satisfaction as well too, perhaps that would decrease the malpractice premiums as well too, right? Like when we have malpractice, when somebody can go ahead and spend that extra time that they have with it instead of hurrying up and getting to that next patient. It's there's so many tentacles in all of this. So it's where is there a voice that outside of you in TEDx as well too, like in expanding, and we have this podcast as well, but how do you feel like feet on the ground could happen? Can there be opportunity to really get the politicians in the room and showing them the numbers and getting them to help and understand to cross the aisle on different topics of this as well too?
I think making the case that this is in our own financial best interest, because I think just saying we think it's the compassionate thing to do is to cover everybody for healthcare. And I think that's what people have been leaning on. I think we need to switch strategies to saying this is the financially sound way to run healthcare is with better prevention. And I think we need to kind of switch the why for the same argument.
Is there, so on Monday, I'll be visiting concierge medicine of West Michigan and two medical doctors that worked for a larger health organization. And although we already know that, the system they have that is not insurance based on there, and you can't use insurance and a subscription system at the same time.
So let me just explain what you're saying because I understand. So there are growing groups of primary care doctors that are stepping off the treadmill, which is a great quality of life for them.
Yeah.
And their pay goes up and the amount of time they spend with patients improves. Patients get direct access. So there's a lot of great things about this, but it's still who's paying that monthly bill, right? So it's people who have the financial capacity to do that and are willing to and interested in paying that monthly bill. It's a great idea for the doctor. It's a great idea for that individual patient. As a country, we have to figure out how to make that model make sense for everyone.
Yeah.
How do we get people who are on Medicaid to have that level of primary care access?
Yeah.
That's a hard nut to crack, I think.
Yeah. Well, and there's doctors that don't want to work in the public health systems that predominantly deal with the Medicaid patients that are out there, but those are the most vulnerable patients.
Because you get paid 10 cents on the dollar.
Yeah.
Right. So again, it's not financially wise thing to do. There, a lot of the doctors around the country limit how much Medicaid they will take because they just can't make ends meet. They can't pay staff and keep the lights on if they have too many Medicaid patients because it pays so poorly.
Absolutely. And it's something that I unfortunately have to help coach and implement those systems because I have this balance of understanding and knowing, and even my children being on Medicaid when, they were very young, and how necessary it is, that it is gut-wrenching to me that I have to find out how we, in this practice in particular, because the route we're going, the volume for which we're receiving a patient base and demographic that their insurance is paying pennies on the dollar, it's not sustainable. Right. And now we're adding on so much more stress to the doctor. We're trying to push in a system where it's more patients during the hour that we see them in. Yeah. And
you're leading to the problem.
Just keep going.
Yeah. But the subscription model, back to your point, you're going to probably talk to some very satisfied physicians with very satisfied patients. And that's great for the segment of the population that can do that.
Yeah.
I think we need to expand that model. In my personal opinion, we need to expand that to be the standard.
I 100% agree. What do you feel like as far as fees go for something that is a subscription model? So I'm making the choice to go there, even though I have health insurance, I have HMO. Right. HMO is just kind of a headache to me because again, too, we have to port through some of these different systems that are going on as well too. And unfortunately, the accessibility to my primary healthcare provider as well too it's not that easy usually. Right. And having an insurance that states I can really only see them as well too, even makes it more difficult. So I'm making the choice, and because I can afford it, to have. Right.
So what if your healthcare insurance paid the premiums on your subscription service primary care and you had no out-of-pocket costs to see them, and they made enough money in that model that they had half as many patients, and so they had more availability? Because we would need twice as many primary care doctors, which gets back to the medical debt of medical students.
We're running in circles.
Big complex web. But I think you need to start somewhere. Yeah. And I think I was asked the question after my TED Talk of, would costs go down with your idea? And I have to admit, if we were going to have universal access, if we were going to give access to primary care to everyone, costs would probably go up because we'd be giving care to people to whom we're neglecting it now
for a long time,
for a period of time until we could start bending the curve.
I mean, that's any change that we have, even processes, it generally costs us more to figure it all out. Right. And again, to get everybody caught up to where they're at, it's going to be a hefty penny. And it's, identifying and I'm so excited to be able to interview them as well, because it's unique. They're the company that they have that helped organize it for, and there's only 13 in the entire country. And you have to be part of a community that can also afford that and understand why it's necessary as well too, right? To be able to go, it's going to cost me less to go over there as a 41-year-old woman that's going through menopause, that's had hip surgery, all of these different things. I just want easy access.
Right.
That's it.
Right.
That's it. That's a less
Right.
headache for me.
Right.
And yeah, so how that would be applied even is that something that you yourself or other doctors of trying to identify how you guys could even implement a system like that here?
That would require us to make a complete revolutionary change, right? So more likely is that a doctor who wants to do that would change practice from something like an independent traditional practice to a direct primary care, which is happening more and more. For lifestyle reasons. You end up seeing less patients in a day. You take better, longer visits with them. So it's a model that works really well, but to switch to it is not really possible to someone taking standard insurance.
Yeah.
What I'm hoping to do is convince, again, go back the 5 whys. Yeah. I want to convince my insurance companies to start paying a subscription model for primary care.
Yeah.
But they're having a hard time convincing their customers, which is the big employers, to think that's a good idea. So I have to kind of keep swimming upstream to talk to the people who are the decision makers here. And then same thing, well, a large number of patients that we see are government paid insurance, so Medicare or Medicaid.
Yeah.
And that's not a Ford Motor Company, that's the US government.
Yeah.
So now we have to start talking about how do we change the US government, and you all know how that goes, trying to change how government works.
Well, and I think that's why a lot of doctors also push back against accessible care that is universal health care, because we don't want any more of the government into these fingertips. Look at what they pay for us now.
Right. 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 Yeah. There is a big, again, you go to countries that have better access and lower costs, but you look at the taxes they're paying.
Oh yeah.
And I don't think any American wants to pay that level of taxes. So I guess we have to, again, go back to what do we want more?
Yeah.
Right.
Yeah.
And I do think in the end we would be paying less for healthcare. And I think that most analysts would agree. We'd be paying less as a whole nation for healthcare if we provided better access as other countries have done.
Yeah. Yeah. And it's, talking to the doctors in those other countries, is their taxes, they're not a problem to them. And of course, there's something to be said for you grow up in it, right? Like you don't know anything different on top of it there. But that's just such a hot topic to talk about, is taxes as well, too, in a capitalistic country. And there's layers and layers.
I think there's a perception, and I give a talk to local college students who are interested in healthcare about our system. And one of the pie graphs I show, and some people can look this up on their own, what is the budget of the U.S. government? So when they talk about cutting out waste, look at the biggest pieces of the pie. It is Social Security and Medicare. Yeah. By far much, much bigger than defense, which is the only larger piece than everything else we ever talk about. So over half of the money that the U.S. government spends is on Social Security and Medicare. So if we're trying to say there's waste in government, I agree with you. It's in Medicare, and it's because we're paying for people in the ER when we should be paying for them in the primary care office. So, yeah, we have to have a loud enough voice. We have to have enough people who agree with that in order to make that change and say, you know what, we need to change the way we reimburse healthcare to have it be more efficient and reduce the costs of what we're paying.
And taking it to the polls for
yeah,
people that agree with
ultimately.
Yeah. I think the only way that we're going to be able to have it taken to the polls is. Again, the right to the root as well, too, is going to those politicians that can be brave enough to say it.
And big business leaders. And convincing them of the truth that I believe, but I'm just one voice amongst many of, I think having a better model of prevention would lower their costs. And then you would get the Jeff Bezos and the Tesla, CEOs going to Congress and saying, you need to change the rules because we think this will save money on our end. Yeah. That's the level that we need to have that conversation.
Yeah. Well, hopefully, maybe I drive a Tesla. Maybe Elon will talk to me someday.
Okay. Give him a call.
You're just handing out millions to people to vote. Why can't
Yeah. Well, I think we're seeing a not recently seen level of big business owners getting cozy with politicians about their own interests.
Absolutely.
Healthcare is a big interest of theirs. So who do we have to convince? Well, I think the politicians are trying to stay in office by representing their districts. We need to start getting other big decision makers in the public sphere to start saying this, and then I think politicians will agree and change. But that's who we have to convince, really, is public and big business.
Yeah. And now it's one of those things of like how to target that as an audience with my podcast as well too, or getting in front of them. And just the money is just constantly at the absolute center of it, and hoping that
if we can prove so I do think the model that we're using with venture capital, as much as those words taste awful in my mouth, is working, and it's driving better prevention, and it's infusing money into the preventive side of things, and it's making money on the back end. It's a successful business model, and I think the more it grows, the more that model grows, I think the more people will be convinced that this really does work. So I think there's research out there, there's experience out there, there's opinions out there, but we really just have to show that it works.
Well,
in the
that's
real
the
world.
communication, like the venture capitalists that are out there, and how, again, too, I mean, it seems like they're the most likely that could get in front of the larger corporations and anybody making those decisions and paying for that healthcare to realize it. Because you or I trying to contact one of these large corporations, it's even if we got through a door, it's just going to be laughed at. I
mean, there's been efforts. Walmart was trying to have clinics. Amazon was trying to do, fix the streamline all the things that they figured they were geniuses. They would fix healthcare, but they're quickly learning they can't, because I think they don't understand the whole preventive aspect of it. And this is my opinion.
Well, it brings me to the thought of even Mark Cuban, who has his own pharmacy, and he was like, you make more money, right? Like he was like, there's still money out there that'd be made because patients are going to have it, but they're going to go and buy it because they can afford it, And so when you're bringing down that overall cost for those medications that we have, and so that's not obviously a free system.
But he can't lower the costs of things that are still on patents, and that's where all of our money is spent. So we just talked about cancer drugs. The newest ones are still on patent. He can't make that for less money because it's illegal. So it's a great idea. I think his heart's in the right place. He's got great intentions. It's not going to bend the curve. But it's a good service. I have patients that use it.
Yeah. Why do you think that there's, or are there, and this is a topic I want to learn more about, is the patents on medication. Is this only an American problem?
I don't know to what extent it's an American problem. I know that we in America are spending a lot more money on the exact same medicines as other countries are.
Yeah.
So why is that? I guess we'd have to ask 5 whys going back on that. But it could be legislated, and I'm not necessarily an advocate for bigger government and more rules and more cutting the red tape, but it would have to be red tape, right? So we would have to say you are only to the point of the Affordable Care Act saying an insurance company can't make more than 15% on administrative costs. Saying something like that to the pharmacy is that you cannot make more than a certain, because they're taking those monies, and granted, we're probably pocketing and giving it to their investors, but then also putting it into research. And that's the argument they make. But Americans are spending disproportionate amount of money on that. So you look at Europe and Canada, they're paying a lot less for the exact same medicines. And that would have to another system that changes. But that by itself would not explain all the differences in healthcare. It's just one piece of a big pie.
All the tentacles and where it goes over. And it's, it was, there's so many ideas I have in my head and so many places I want to be able to visit. When my sister and my brother-in-law go back to India, where he's from, and they can bring back the same medications for pennies on the dollar, walking right into a pharmacy and requesting it. Yeah,
the FDA will tell you to be careful of the quality of that manufacturing.
And I get that as well too, right?
Yeah.
I definitely, when you don't have some of those regulations, and that's kind of my big vicious circle with the FDA is like, it's there for a reason, but it's also preventing, a handful of other aspects of it. And now we have compound pharmacies, and I'm selective if I'm bringing medicine home from another country, that's for sure. So, but we were able to get our son in France. Portugal. We were able to get him an inhaler, an albuterol inhaler, just walking right in the pharmacy. There it was. And I took the opportunity at that point to think, well, I pay a lot of money for my Retin-A. I was like, can I get this over the counter? And they're like, no, that's a prescription. I'm like,
so unfair.
My skin and wrinkles.
It's a medical necessity.
Right, exactly. And I'm like, but the albuterol, here you go. It was like $3. And I was just like, oh my gosh, it is. And that just proves that there's not a perfect system out there. But we have to move towards some change because the system we've been in this vicious circle for so long.
Right. I think everyone's coming to agreement. If we have such polarization on disagreement about the fix, I think we're coming to consensus on the problems.
Yeah.
And that this is just not working.
Yeah.
So.
Yeah. I'm hoping that interviewing intelligent people and passionate people like yourself and others across the nation, as well as we can actually make sustainable change.
See if we can get some traction,
Continue.
get some people to agree with us and start changing minds.
This uphill swim on the river is really hard. So it is. And we're a very, very small majority that's out there and that wants to take the time to have a voice about it, to try to educate others, because that's that whole other level that people, they don't want to. So, well, I absolutely enjoyed every moment of visiting with you and what you taught me during this time as well too, because similarly, I don't know nearly as much about in the health care side of things as what I do dentistry. I just know as a patient myself, it's not working.
It's frustrating.
Yeah.
You yell at the sky, but you don't know if anyone's really listening. And, we understand the problems. I think coming to the solutions are harder.
Yeah, it is. Well, we'll keep pushing for it. And I think that I'm going to visit a handful of other places and probably want to come back to you and talk to you and say, look at what I've heard.
Absolutely. Yeah. You can educate me then.
Yeah. I really, honestly, I think that's the part that I think is beautiful of what I'm doing is let us at least see what's happening in other countries because it's not the same. Right. It really genuinely is not. Right. And so I think that's also helping, even though I can't find this perfect solution that, everybody might be striving for, I'm providing the options that are out there and also saying there truly is nothing perfect. That's not what we're striving for, right? We're just striving for something better.
Yeah. Don't let the 10% that could go wrong get in the way of 90% that could go right.
Yes. Well, thank you again. You're a wealth of knowledge. You're a great voice for the community. And I'm so lucky to have somebody like you in my own backyard as well, too.
Well, I appreciate having the platform to try and help more people understand what it is that I've been learning in the roles I'm in.
Yeah. Excellent. Well, we will be revisiting some things. I'm going to share some stuff and come back on air.
Absolutely.
Excellent. All right. Thank you so much. Yeah.